webinar hosted by the BRAC, James Streetman School of Public Health, BRAC University. My name is Rafi Tamzid, and I will be your MC for today's webinar. Today we have a very interesting webinar, and it's titled Food Consumption Among Low-Income Population in Bangladesh During COVID-19, Impact and Recommendations. On our panel today, we have 4 distinguished speakers, and the speakers are Mr. Sadruddin Imran, Chairman and Lead Consultant from Innovision Consulting Private Limited, Rubaiyath Sarwar, Managing Director and Lead Consultant, Innovision Consulting Private Limited, Dr. Malay Kanti Mridha, Professor and Director of the Center of Excellence for Non-Communicable Diseases at the BRAC, James Streetman School of Public Health, BRAC University, and finally, Mr. Ahmed Shamim, Associate Scientist at the BRAC, James Streetman School of Public Health, BRAC University. Just a little information for everyone before we get started. Panelists, you will have 10 minutes each for your presentation, and to the audience members, if you have any questions during the webinar, please type them in the question box in Zoom and also on our Facebook Live. We are streaming on Facebook, so please type your questions. At the end of all the presentations, we will have a combined question and answer session after all the discussions and presentations are over. So now I would request Mr. Sadruddin Imran to please begin his presentation. Our IT team, Mr. Rauf, if you could please bring up the presentation on the screen, please.
Thank you very much, Rafi.
Thank you very much.
Good afternoon, everyone. So this presentation is on the low-income population's food consumption during COVID-19. We would like to discuss some impact, and we would give some recommendation, but the distinguished panelists and the audience here can of course add or ask questions. Next, please. So this is briefly about Innovision. Innovision Consulting was founded in 2008, and we have worked in 16 countries of Asia and Africa. We have served over 110 clients and completed more than 265 projects. Next, please. So when we are talking about low-income professionals, we have covered 8 distinct groups: bus, truck driver and helpers, carpenters, construction workers and masons, then housemaids, owners of small restaurants, rickshaw pullers, 3-wheeler driver, wage earner, and agricultural laborers. And the data that we are going to use for this presentation, this was collected in the last week of April 2020, which means the information at the time of the collecting information, the countrywide general holiday or lockdown was still in force. Next, please. Okay, so let's get the demographic information of the respondents briefly, and then we will go to the food consumption related information. So we have primarily collected data from 4 divisions: from Rajshahi division 23%, from Khulna division 26%, from Chittagong 23%, and from Borishal division 26%. 26.6%. From Sylhet, there were a couple of respondents, but the information was mostly covered from these 4 divisions, and it's almost equally distributed among the 8 groups. The total sample size was 244. Next, please. So if you look at the family size and average age, the family size is 4.7. It's slightly more for the male-headed families, 4.8, and for female it was 4.3. And the range is from 4.1, which is for the owner of small restaurants, and the highest is 5.3, which is for bus, truck driver and helpers. In terms of age, average age is 38, and the range for different groups are from 35 for housemates to 43 for owner of small restaurants. Next, please. Okay, the gender distribution, because of the nature of these professions, our sample was predominantly male, 82% overall, where male respondents, only 18% were female. But if you look at the gender distribution of specific group, for example, housemaid, 100% respondents were female, because this is typically the job of the female in our country. But all other occupation group, it's mostly male. And in many professions like bus truck driver, like owner of small restaurant, like three-wheeler driver, like carpenter and rickshaw puller, 100% of the respondents were male. Next, please. We try to cover the rural population group more. So in our sample, 92% were from the rural areas. Innovision did a number of studies during the COVID-19 period, and we covered the urban population groups separately, but this specific one is primarily for the rural groups. Next, please. Okay, if we look at the income, average monthly income has quite a lot of variance. For male, it was over 13,000, whereas for female, the average is just over 5,000. And if we look at the occupation group, bus truck driver helper, they earn the most among these groups, over 17,000, and the housemates, where I already mentioned 100% were female, they earn merely 4,156. The overall average is slightly below 12,000 takas. Side, the percentage of total family income for different group, the respondents that we have covered, other than the housemates, all of these people are the dominant earning member in the family, and the average earning member in the family is 1.6, so slightly more than one person. But in most of the cases, they are the ones who contribute the most in the overall family income. Next, please. Okay, we also try to look at the savings and loan situation. These people have a very low level of savings. The average is just over 8,000 taka, and they save on an average 528 taka per month. But considering the income level, it's 4.4% of their income, so that's not bad. And although female, they have much less saving, but in terms of percentage, they actually save more, even with their lower earnings. So they save 5.5%. Compared to males 4.2%. The loan amount is almost 4 times of their saving amount, which stands at 36,187 taka. And if we look at the different saving schemes, the most popular is saving with NGOs. Then some of them they save at home. Then some have DPS and so on. But bank access to bank is quite low among this group. I mean the formal financial institutions. Next, please. So we would like to see how they have coped the lockdown situation. Next. So the impact was pretty severe, for 50% of the people, the income decreased, and for another 47%, the income decreased to zero. So they had no income. So for 97% of the people, there was a severe decrease, or even the income came to zero. And this is across all the occupation group. The scenario is more or less the same. Next, please. Okay, so how they are surviving? First is we have seen the income when we try to quantify, it decreased by 83% compared to the normal situation. Only 6% managed to get some work during this period, and they have the cash or bank balance that can support their family for an average of just 8 days when we did the survey. And the situation is most severe for the housemates. They had saving for just 3 days, and comparatively the better situation is among the bus and truck drivers, who can support themselves and their families for 15 days. In terms of availability of basic food grain in the house, they have 11 days of basic food grain in their house. There are some variances, but yeah, it's a pretty dire situation for all these groups. Next, please. So let's come to the impact on food consumption, which is the core topic of our discussion today. So what we have seen in normal time, these low-income people, on average, they spend 3,259 taka on purchase of protein, basically animal protein, fish, meat, etc., which is 27% of their monthly income. And we have seen that rickshaw pullers, they spend the most, over 5,000 taka, and housemaids, naturally, since they have low level income, they spend the lowest, 1,700 taka. From our respondents, 94% they have reported they had to reduce spending on the protein content, mainly fish and meat, and they have almost halved their protein food expense. And majority of the respondents, big majority, 89%, they decreased their non-protein food expense, even vegetables and even grains as well. Because there was uncertainty with their income, they cut down the expense on food. It's a bit different among different groups. We see that the construction worker masons, they decreased the least, 38%, and rickshaw pullers, they decreased almost 2/3 of their spending on protein items. Next, please. We wanted to see whether there is any relation between the availability of these essentials in the nearby market. So when we ask these people, in most of the cases, food item plus non-food item, things were more or less available even during the lockdown period. Rice and other grain were available everywhere. Fish and meat were available almost everywhere. Vegetables were available everywhere. And different other things, these were more or less available. So availability or supply chain disruption was not really a problem. It was more of a problem of either the lack of income or lack of knowledge of alternative food items that they can consume. Next, please. Okay, we all would also like to see whether they were getting any assistance during the lockdown. 81% responded that they do not have any assistance, or they are not subscribed to any assistance program. Only very few people were kind of getting assistance. 2% were subscribed to Kabhi Kha Kabhi Ta program. 6% were subscribed to 10 taka kg rice, 5% on VGD, 4% on old age allowance, etc. So most of the people were actually not getting any assistance. Next, please. Okay, another way is we asked whether someone helped them in cash or in food items, and 66% responded they have not received any assistance whatsoever. The 23% responded local government offices like Union Parishad member or chairman, they gave some assistance. 11% mentioned volunteer individuals, so philanthropists basically, they provided some assistance, and then there are some negligible other areas, 2% and 1%. Okay, so we wanted to see what is the impact on their food consumption, as we have seen that their income is quite low, and they have very low level of savings. So we asked different groups what will be their response, or what will they do if the lockdown or general holiday continues for another 15 days and continues for another 30 days. We have already heard that they have cut down on their expenses on different food items, but we wanted to quantify that. So for rice and other grain, 54% said that they will not cut down in 15 days, but if it continues for 30 days, that comes down to 29%. 32% says for rice, they will cut down up to 25% within 15 days. That increases to 39% in 30 days. For protein, the situation is quite different. 46% said they will cut down up to 25%, and 29% said they will cut down up to 50% within 15 days. And that increased significantly. 21% said up to 25% cut, 26 to 50% cut will be done by 39%, and the ratio increases actually with the time. We did this for all 8 groups, so let us quickly go through the next few slides. Next slide, please. So this is for the carpenter. If you look at the fish and meat area, within 15 days, they have said they will not consume at the same level. 28% said they will reduce by 25%, 41% said they will reduce by up to 50%, 24% said they will reduce by 75%, and 7% said they will reduce by 7%. If you see the right side for fish and meat, which is for 30 days, that 75 to 100% increases to 31%. So we can see, the severity. And if you look at the vegetable segment and even rice, in all cases, they are opting for further reduction of their food intake for rice, for fish and meat, and also for vegetable. And this has a lot of implication for the nutrition aspect of these people. Next, please. This is the picture for the construction worker, and we see a very similar situation. There are, of course, a difference in the percentages, but the structure is very similar. In 15 days, they are reducing the amount, and in 30 days, they are reducing it even more. Can we go to the slide after this? We have very similar pictures for all these income groups. Can we quickly go next? Again, next. Yeah, let's go after this. Next one. Again, next one. Yeah, next. Yeah, this is the last group, wage earner agriculture labor. And as I was saying, very similar trend. The pink color is increasing on the right side. The dark yellow orange color, and that is increasing. The gray color is decreasing. Yellow color is decreasing. So people are becoming desperate as the time of lockdown was increasing, and since they have no income, they had no other option but to reduce their food consumption. Next. Okay, so we have seen the choice of reduction of specific food item is directly correlated to the income and savings of the specific groups. Some of the groups, the variation is slightly different. For bus truck owner, as we have seen, their variation is slightly different than other ones, but the general trend actually is the same for others. Rice and other grain consumption is relatively inelastic, so they wanted to have rice at the minimum. With the extension of lockdown, people have no choice but to cut down higher portion of specific food items. So they are consuming less than what is required. We know that there is specific calorie requirement, and the way people were kind of cutting down, the calorie requirement cannot be fulfilled. Next, please. Okay, so if the situation continues, we asked people that if they do not get any assistance, how long they will have to wait for them to cut down at one meal. So going to 2 meals from 3 meals. And 16% mentioned they will have to do it now. At the time of our interview, within 15 days, another 31%, and within 30 days, another 23 days. So in 30 days, basically 70% of the respondents, they have to cut down one meal altogether from their daily diet. Next, please. So from this, we tried to convey some recommendations. So one thing is the savings, and savings we have seen for the low income group, these are really small and they are in a very vulnerable situation. There should be initiative to provide incentive to the low income group to save systematically, so that in terms of this pandemic is very much unprecedented, but there can be different problems, issues that can come up, and if they have saving, they can actually survive for some period. And then lending coverage from formal financial institution is really low, so people are mostly relying on support from friends, relatives during lockdown, and it is unlikely that these groups, the friends and relatives, will be able to continue for long. And the low income groups, they are not benefited from government's bank based incentive package. So there has to be increased effort to get these low income people under banking coverage. Next, please. We have seen that very small percentage of low income people, they are getting government NGO support. So they need to be identified by local administration leaders and provided support till the situation eases. A lot of people, they are not able to get back to the regular job even after the general holidays lifted. So they still need support. And people are cutting down on protein items first, but also cutting down on vegetable and rice. Many are thinking of cutting down one meal completely. So if the situation prolongs, this will have long-term nutrition impact on the people. Next, please. Okay, so what we want to recommend is for this, people need to be kind of made aware of the nutrition value of different product and its health impact, and they can try to, or people can be made aware to try kind of cheaper protein options like pearls and eggs and milk. We have seen that farmers in the rural area, they were not able to sell the milk and they have to destroy their milk. So these can be consumed by people. They can buy it at a cheaper rate, and the nutrition can be maintained in that way. So thank you very much for all your attention. That's all from my side.
Thank you so much, Mr. Sadruddin Imran, Chairman and Lead Consultant from Innovision Consulting Private Limited, for your presentation. I would now request Mohammad Rubaiyath Sarwar, Managing Director and Lead Consultant also from Innovision Consulting Private Limited, to please start your discussion.
Thank you, Rafi. Thank you so much. For the sake of the time, I would try to focus on very specific issues. The first point is we are going to see a huge divide between urban food and nutrition cycles and rural food and nutrition cycles. So policymakers need to really understand the divide and how it is unfolding. So, I mean, what we are seeing is that, I mean, Imran was showing predominantly rural data, but also even in urban areas, we are seeing that people are cutting down on fish and meat and protein diets. So the division needs to be considered. Our urban and rural areas there, food consumption behaviors are different, accessibilities are different. So, which is why we also need to understand and analyze how these are different and how we should mitigate that. So in that context, I can cite the example that in rural areas, we often have, let's say, some nutrition sensitive interventions where people are growing vegetable in the homestead and they can consume it. They have access to some chicken, they have access to eggs, and we were hearing that when people were not being able to sell the milk, they were basically consuming it on their own. So the dynamics are very different between urban and rural areas. So we need to consider that. As I was saying, that nutrition sensitive interventions and nutrition specific interventions, so the divide of it and the need of it will come up more sharply in the next few months. So I will say that we will need both. We will need nutrition specific interventions. The reason being that the children who are born, I would say the COVID children in both urban and rural areas in the low income population in the last 3 months, the households are not being able to provide the nutrition that they require. So we basically had this question actually in our construction worker survey in urban areas, where 88% of the samples who had children from the age from 0 to 5 years, they said that they were not being able to provide adequate nutrition to their child. Also, we asked, I mean, if they had pregnant women and in their household, if yes, whether they were able to provide nutrition for the pregnant mothers, pregnant women, and they said they were not able to do so. So and that impact needs to be considered. So in that context, I mean, as you all know, that the first 1,000 days for children is very important, and the nutrition for the mothers is also very important. Now we are losing time, and these people don't have the support. And what we are seeing is that the relief that is reaching them is mostly generic, which is rice, and in some cases potato. And this is not going to really serve the demand for the people or the need of the people. So when you are designing any relief program, I would suggest that please consider the nutrition aspects. And if you're doing selective targeting, target those households which are food vulnerable. And if you're targeting those households which are food vulnerable, you can easily understand whether there are children and whether there are pregnant women. And then you can basically design some nutrition specific interventions. That's for the short term. Now, I can also give you an example. We are running a very transformative livelihood response program called PROSHAR, which was designed as a pivot by Innovision together with Wearable Digital. So in this pivot, we provide 660 taka through 600 taka through local micro merchants, and the listed beneficiaries, they can purchase whatever they want for 1 week support of 600 taka from the local micro merchants. We are now basically undertaking a midline survey, and what I hear from my enumerators is that the households are purchasing eggs and lentils. So that already shows that they see the demand, they see the need, but they're purchasing more of eggs and lentils, but not really, I mean, meat and fish. Now, and I believe it is going to have also a deeper impact on, let's say, the consumption of pangash and tilapia, which traditionally we understood as the fish for the poor. And so there will be decline in both consumption and supply of this. So on that context as well, we need to think about the dietary diversity, but also when thinking about dietary diversity, we need to think about, let's say, what the poor people can consume given their limited income. Now, one example to provide, when we are doing the study on the people with disability, we had a very deep insight. We were seeing that they were not cutting down cost on, let's say, the daily expenses like snacks and tea, but they were cutting down cost on protein. And I tried to understand why that division. And what I figured is that they were consuming protein items on a weekly basis, not on a daily basis. So what happens is that when you make a weekly purchase or a bi-monthly purchase, you incur a huge cost at a time. But when you are spending daily, you probably don't think about the total expenditure. Now, in our country, the packages for nutrition items, apart from vegetable, if you're talking about fish and meat and others, these are not consumed, I mean, let's say in small pack sizes. These are consumed in larger sizes, in kgs and so on and so forth. So because we do not have the system to, let's say, provide even to the low income population, the smaller size packages for even milk and others, so there is going to be an impact. So we probably need to reinvent how we market the nutritious food for the poor. And finally, I would say that moving forward, when we are, I mean, the policies in Bangladesh, Innovision has done a very rigorous assessment on the nutrition sensitive and nutrition specific policies in Bangladesh, and we provided that roadmap to DFID. It was done in December last year for ID, specifically for the Shujana program. And we have systematically showed that the major problem there is that the multi-stakeholder engagement that needs to take place for the nutrition specific and nutrition sensitive interventions is not operational, is not functional. So, I mean, to win on the COVID impact, what we will need is basically these multi-stakeholder relationships and interventions to SPA, and that would happen through partnerships between the private sector and the NGOs and the government. And how it can happen is that the government can do the targeting, the NGOs can do the targeting, and the private sector could probably do the, I mean, packaging or create new packets for nutrition food. And with an example, I guess 2 years back, I heard that, what's the name of this company? I forgot. Oh, okay, Tetra Pak. So Tetra Pak, they undertook a survey on garment workers, and they figured that the size of the package of the milk had an impact on consumption. So they brought in smaller sachets of milk, and that increased the consumption of milk amongst the garment workers. So that's exactly the kind of interventions that I'm saying that needs to happen now across both urban and rural areas. Thank you.
Thank you, Mohammad Rubaiyath, for your discussion. I would now request, can you all hear me? Yes, sorry, my connection is a little disturbing. First of all, I would request the audience members, if you have any questions, you can type in the questions in the chat box that we have on Zoom and also on Facebook Live. Now we'll go back to the rest of the presentations. So I would please request Mr. Abu Ahmed Shamim, Associate Scientist at BRAC James Strickland School of Public Health, to begin his presentation, please.
Okay, good afternoon, learned audience. So I am presenting along with Professor Malay on maintaining a healthy diet during pandemic. What is the recommendation? So we shall talk about why we need good nutrition during COVID and what is the recommendation about healthy diet. And the last part will be covered by Professor Malay, frequently asked questions and answers. So, until now, COVID actually appeared suddenly. No food, nutrient, or dietary supplement can, it is conclusively proved that any food or nutrient or supplement can prevent COVID infection, but maintaining health requires actually consumption of a balanced diet, and good nutrition is important before, during, and after infection, because infection increases our demand for both nutrients. And we shall cover why, sorry, I go back. So we reviewed the recommendation provided by international agencies like FAO. So FAO released a recommendation maintaining healthy diet during COVID-19, and in comparison to the Bangladesh dietary guideline, actually we shall see what is the international recommendation and what is the recommendation of our dietary guideline. So recommendation of dietary guideline, recommendation number 1 is eat a variety of food within each food groups and eat a well-balanced diet. So we have to eat more of energy-giving food, which is cereals and tubers, and plenty of fruits and vegetables. And we have to, to be healthy, we have to eat protein, some milk, and a small amount of fats and oil, and even a smaller amount of sugar. And if we actually see the proportion, the Bangladesh dietary guidelines suggest that our total diet, about 50%, 53% should be rice, and cereal, remaining half of our plate should be other food, which should include vegetables, pulses, fruits, about 6% of protein food, and some pulses. And there are actually suggestions about amount in the dietary guideline. So I am not actually detailing the amount. We shall share the presentation. And so eat plenty of fruits and vegetables. It is important because everybody, we eat plenty of cereals. Even during an emergency situation, we do not sacrifice that. So the recommendation is to eat 5 servings of fruits and vegetables every day, because one of the reason is COVID disproportionately attacked the obese and people with other complications, so diabetes and chronic diseases. And to be healthy, we need to eat some fruits and vegetables along with other food items. So recommendation 2 is consume moderate amount of oils and fat. And about this, there are specific recommendation that we should consume less saturated fat and more of unsaturated fat and limit the intake of deep fat fried food because those are rich in saturated fat and trans fat, which are not healthy, especially the snacks. To be healthy, we should limit intake of salt, and we should only use iodized salt. Recommendation 4 is, so there are some recommendation to increase some food and nutrient, and there are some recommendation about reducing the intake of some nutrients. So limiting sugar, sweets, and sugar sweetened drinks. Recommendation 5 is drinking plenty of water daily, and our dietary guidelines suggest that we should drink 1.5 to 3.5 liters of water daily. So recommendation 6 is consuming safe and clean food and beverage. Dr. Malay will cover. We have a lot of questions about safety of food, especially grocery items that we purchase during this pandemic. Recommendation 6 is maintaining desired body weight. Actually, in Europe and other countries, we have found that obese people actually develop more complication compared to healthy people. So that is why out of the 10 recommendation, 1 recommendation is to maintain healthy weight, and this is also our dietary guidelines suggest that we should maintain our body mass index within 18.5 to 23, and our waist circumference within 90 centimeter for male and 80 centimeter for female, and healthy waist to hip ratio. Recommendation 8 is practice healthy lifestyle. So even during COVID, we have to eat healthy, cook rightly, and also exercise. And so there are some recommendations regarding actually how to prepare vegetables and avoid reuse of fried oil and sleeping immediately after a major meal. And recommendation 9 is eating additional food during pregnancy and lactation. And 10 is maintaining exclusive breastfeeding. So now there are convincing evidence and recommendations from most UN agencies that even if there is risk for COVID transmission, the benefit of continuing breastfeeding actually outweigh the risk. And in conclusion, even though there are lockdown, there are possible to purchase and consume a healthy diet during this difficult time. And diet vary greatly from place to place. But yet, when it comes to food, there is lot we know about how to select right combination of food to attain a healthy diet. And to do this, we have now recommendations from FAO and also the dietary guideline for Bangladesh, which is developed by Bardem with assistance from FAO. So thank you. So now Malay actually continue.
Thank you very much. Now I would request Dr. Malay Kanti Mridha, Professor and Director of the Center of Excellence for Non-Communicable Disease at the BRAC James Mridha School of Public Health, to continue the presentation, please. Professor Malay, over to you.
Yeah. Can you see my screen?
Yes, we can see it.
Okay. Thank you very much, dear audience. So this part of the presentation is about some questions and answers related to food and COVID-19. And so I will try to answer some of the frequently asked questions. And so the first question is whether someone can get COVID-19 from food or food packaging. So there's currently no evidence about transmission of COVID-19 from food packaging or food. But like COVID-19, the virus, novel coronavirus, it can survive on surfaces for some time. So, and the evidence keeps changing. So we need to take precautions, and I'll talk about some of the precautionary measures later on. And the other question people may ask is, can the virus multiply in foods? Yeah, the answer is no. Coronaviruses cannot multiply in foods, but they because they need to multiply in a live animal or a human host. Question number 3, which is about, I talked earlier that coronavirus can live on surfaces or food packaging, and there are recent evidence from different published literature that it can remain viable up to 72 hours on plastic or steel surfaces and up to 8 hours on copper and cardboard surfaces. And but still, like, there is no, when you handle these food packages, there is no need to disinfect food packaging materials, but after handling these food packaging materials, we should wash our hands with soap and water. So other people may ask this question about, like, whether we need to wash fruits and vegetables, and if we need to wash fruits and vegetables, how to wash them. So washing fruits and vegetables with potable water is sufficient. We don't need to use any soap or detergent to wash our foods. Then other questions may be, how long is to cook food and to what temperature to kill the virus? And coronavirus is not different from other bacteria or viruses, and you know that most of the bacterial viruses can be killed at 70 degrees centigrade temperature. So if we cook food for sufficient amount of time at 70 degrees centigrade or higher temperature, the food will kill the virus. The temperature will kill the virus, and the food will be virus free. But storing food is, we need to be a little more cautious about how to store food, because the danger temperature is from 5 degrees centigrade to 60 degrees centigrade. So if you keep your food stored at room temperature for more than 2 hours, so there is a chance that bacteria may grow in the food. So keep the food in the refrigerator, or I mean, in a temperature that is like when you eat food later on, so you can reheat food so that, like, it doesn't have any virus and bacteria again. There are many questions about grocery stores, like while going to the grocery stores, what precautions should a person take so that she or he doesn't get infected from coronavirus. So of course, like, everybody should wear a mask, and there is some new evidence that, like, coronavirus can have an entry through our eyes, so spectacles and goggles will also be helpful. And while in the grocery store, we should keep a safe distance, which is at least 1 meter distance from all other shoppers or staff in the grocery shop. And before entering the shop, we should wash our hands, or like sanitize our hands with hand sanitizer. And within the shop, we must avoid touching mouth, nose, or eyes during shopping, and minimize direct hand contact with food. And one important point is, if possible, like, we'll use contactless payment rather than cash or notes. And we are also ordering foods online and also groceries online. So this is safe, and if the provider also follows good personal and food hygiene practices. But of course, after accepting food and grocery deliveries, we should wash our hands with soap and water. And if there is a food delivery from like a fast food shop, we must reheat the delivered food before eating. There can be questions about household disinfectants. For cleaning household surfaces, we can use the available disinfectants and cleaning materials. But if there is a person in our home who is suspected or confirmed COVID-19 case, then surface virucidal disinfectants like 0.05% sodium hypochlorite, which is bleaching powder, should be used, and also other products that has at least 70% ethanol should also be used to clean the surfaces. And I mean, apart from the grocery store, people can have questions about whether it is still safe to go to food markets. Yes, it's safe with some precautionary measures. Like I told earlier, we need to keep ourselves at a distance of about 1 to 2 meters from other shoppers or staff, and we should wear face mask, wash and sanitize our hands, and put on spectacles or goggles. And it should be made sure that there are good manufacturing practices and good hygienic practices, standards are maintained in the market as well. One tip about reducing food waste is important in this crisis, because as we heard from other presenters, that like there is a crisis right now, and people are kind of like not being able to buy the food they want to buy. So we must reduce food waste in this regard, and that's why it is important to when we ask for food from our family members, if we cannot eat much, like we will ask for smaller portions. And also, like if there are leftovers, we will keep the leftovers and eat them afterwards. We can shop smartly, and one of the ways to do that, like sometimes like sometimes fresh fruits and vegetables, they look ugly. They don't like look. I mean, the shape is ugly. Not they're just not fresh, but we can buy them. And of course, like when you keep food items in the refrigerator, so one rule can be followed is first in, first out. And of course, like the dates and expiry dates of the food should be checked. Sometimes, like we can, I mean, cultivate some vegetables on our rooftops and also in the villages, in the gardens. So we can turn our waste into compost for doing that. And of course, like if we have something to share with our neighbors and others, please share your food with others so that and give and help others. And there's many questions about vitamin D and other micronutrients. So I mean, many people are actually taking vitamin D supplements in these days. So the question can be whether there is any role of vitamin D. Yes, vitamin D is an immunoregulator. It may have a role, but there is no conclusive evidence for COVID-19 prevention or treatment, or whether it can be used as an adjuvant therapy. But a systematic review found that like it is helpful for acute respiratory tract infection. And that is also true for vitamin C and vitamin A. Zinc is also has some immune functions, immunomodulatory functions. Vitamin B and vitamin E also have those functions and may have a potential role. I would like to point on obesity as well, and obesity is a risk factor, you know, like, and there is a French report that obesity, people who are obese are likely to go to mechanical ventilation compared to more likely to go to mechanical ventilation compared to non-obese patients. And Bangladesh government is also working on recommendations for nutrition with respect to COVID-19 prevention and treatment. So some of the recommendations have already been highlighted by Shamim in the prior presentation. And when we go outside, as I mentioned earlier, we should always use face mask, keep ourselves, keep distance from others, wash our hands, use hand sanitizers, and also use spectacles or goggles. And we shouldn't go outside without any essential reason. And when we are coming out from outside, we should wash our hands, we should wash our clothes, and if possible, we should take a shower. And one thing is also important, that we shouldn't take any medicine without consulting the physicians. So thank you very much for your patient hearing. Thank you.
Thank you very much to Professor Malay Mridha, Director of the Center of Excellence at the BRAC, James Srigan School of Center of Excellence of Non-Communicable Disease at the BRAC, James Srigan School of Public Health. It is now time for the question and answer session. We actually have a lot of questions. So what I'm going to do is I will ask the questions in groups. Let me take out the questions. So the first question that we have, it is to Mr. Imran Sadruddin from Innovision Consulting. Mr. Imran, the question is, regarding your research that Innovision has done, how was the sample selected for the survey? Do you think that, the question was that, do you think that maybe the sample size is too small to say the correlation between food consumption and income? And also, I also want to ask you another question with this, which is, what about the price sensitivity of the study? Which means that, if inflation of essential items pick up, what impact would it have on the studied parameters? Imran, are you there?
Can you repeat the question? Sorry, I probably missed the question. Can you repeat this?
Okay, sure. I'll repeat it. So it's actually two questions in one. The first question is, how was the sample selected for the survey? Do you think the sample size may be too small to say the correlation between food consumption and income? And the other question is, what is the price sensitivity of Innovision study? Which means that, if inflation of the essential items pick up, would that have an impact on the study parameters?
Okay. On the first question, as I mentioned in the first slide, Innovision has done close to 300 studies, and we have access to information for over 250,000 people all over the country, covering all the districts, divisions, etc. So from there, we actually randomly selected this sample. I agree that it's not enough in terms of size, and if I go with the statistical significance, there might be question, but you need to keep in mind that this was done as a rapid survey, and the intention was to understand the situation as quickly as possible and not to have more of an academic rigor. So although I agree with the spirit of the question, I think the reality was not to go with a very thorough design for the study. Actually, we have seen in many cases, and there were literature as well, that if you go over a certain number, the difference actually becomes very less. So we are very confident on the findings, although as I mentioned, if we go with proper statistical equations, some questions might be raised. On the second part, we have not really covered the price sensitivity test, but we can assume, based on the income level that people have, if the essential price of the essential goes up, of course, there will be much more severe impact. People will have to even cut down on the food items much more than what we have projected here. Dr. Malay showed in his presentation the requirement of different type of vegetables, fruits, minerals, and vitamins. Yeah, I think people will have to resort to just plain rice and maybe chili and salt if the price goes even higher.
Rafi, I just wanted to come in a little bit on that question. We did not do a price sensitivity analysis, but I asked the participants to go to Innovision's website and download some of the reports. So for example, in the RMG worker survey, you will see that we have done an assessment on time-based analysis. Let's say if the shutdown continues for 15 days, what would be the impact? If the shutdown continues for 30 days, what would be the impact? So you would see how the impact range changes between food and non-food item and between essentials and non-essentials. And that was repeated for several surveys. So, if one compares the data, you will see the trend is similar. So even though the sample is, for one study is small, but if you compare across the different categories, it remains consistent. Also, what we did is, because these were all a digital survey on phones, so we were tracking, at what level the information was not changing anymore. And you would be startled to know that, in some cases when we were testing it, after 50 samples or 60 samples, the results started to almost freeze. It started to become, similar. So one question that, Innovision was probably the first. We started with Rishabhpura survey in March 26th. It was a very small survey with 30 samples only. And we were asked this question repeatedly by many, that why we are not increasing the sample size. We are in a war situation. And in a war situation, it's not your duty to try to do academic rigor and forget about the necessity. By the time you complete the survey, the relevance of the findings will be gone. Few of the cornerstones for studies are relevance, validity, and also, let's say, the cost effectiveness. So we looked at those more rigorously, and I would say that if you can, from the mindset, take away, remove the block that it has to be.
Can you all hear me? Yes. Okay, sorry, my connection was disconnected. So, Rubaiyath, Mohammed Rubaiyath Sarwar, we have another question for you, which is, we actually have this question from the BRAC education program. One of our colleagues just came in. So, have you done any research on how food consumption in low-income family has an impact on the primary education, specifically for special needs children? Do you have any idea on that or any research on that?
This is a very good question. I was looking at it. No, we haven't done any study that I can relate it to. But it's a good question. There are some studies lined up that are coming up. So probably we can take it up and then just put a question inside, and there will be some useful insights coming out of that. Thank you for raising that question. I'm sorry that I cannot answer directly.
Thank you so much. Now I would like to ask Professor Dr. Malay. I think Professor Shamim has also spoken about this, that is it safe to breastfeed a baby if mother is COVID-19 infected?
Yes, it's safe to breastfeed a baby, like if mother is COVID-19 positive. The only precaution the mothers need to take is like when while breastfeeding the baby, she should wear a face mask, and if possible, she should wear a face mask.
And another question as well, that is to you as well, Professor Malay, which is obese people are at a risk of COVID-19. We know that, and it's not easy to reduce their weight and gain normal BMI within a short period of time. So what can they do now to protect themselves? Okay, so obese people should, take extra precautions so that they don't get infected from COVID-19. So, because once you get infected, so you obviously have a higher risk. So take additional precautionary measures. Thank you so much. Now, a question to Mr. Shamim. Because of the lockdown and the restricted movement, we are all involved in very little physical activity. And how is this affecting our overall health in addition to malnutrition? What are some activities people can do while staying at home to prevent these things from happening to us?
Actually, this is an important question. We know that obese people's outcomes actually can be very adverse outcomes. They are at higher risk of adverse outcome. And during lockdown, obesity actually increasing for basically two reasons. One is people's physical activity actually limited, and second is it is called stress eating. When people are in stress, so there are reports that consumption of snack food is increasing, particularly deep fat fried and salt, sugar, and fat-rich snack food. So we should be aware of that we should avoid consumption of unhealthy food and try to do some exercise indoor. So walking within the room or climbing stairs or walking at roof, and even outside maintaining precaution. So social distance and wearing mask. So thank you.
Thank you so much. The next question is both to both our Innovision colleagues, to both Rubaiyath and also Imran, right? Which is, some people are cutting down on animal-based protein to reduce expenses. What are maybe some cheaper alternatives to animal-based protein? Maybe vegetable-based protein or something else. What could that be?
Yeah, let me take it first. Rubaiyath can probably add later. Actually, Dr. Malay and Shamim, they can also add. Of course, there are good, plant-based protein items that actually are quite cheap compared to the animal-based protein. So pulse is a good alternative. Different types of beans, these are good source of protein. Even in the animal-based protein scenario, eggs, these are relatively cheap, and people of all ages, they like to consume eggs. And Rubaiyath was mentioning about Innovision's another initiative, Proshar, through which we have been supporting different low-income groups, vulnerable people. And we have seen that they also purchase, milk, either the liquid milk or powder milk. Milk has a lot of advantage because one, you can of course feed it to your children at home. Then milk can be used not just for consumption as a liquid, but also in preparation of different milk-based food. just before the Eid holiday, it was all holiday, but just before the Eid, when we distributed this money, we have seen people were buying, shemai, latsha shemai. But together with that, they were also purchasing milk. After the Eid, the latsha shemai purchase was stopped. They did not purchase any more latsha shemai, so that was exclusively an Eid item. But they continue to purchase milk, egg as well. So yeah, I think these are relatively cheaper alternative that people can get if they cannot afford the fish and meat items.
Mr. Rubaiyath, would you like to add anything to this? Or any of the other panelists?
No, I'm fine with Imran's response.
Okay, sure. The next question we have is...
I want to add one
sure,
point.
Shamim, please go ahead.
So at the time of crisis, actually, another question is prioritization. Growing children, pregnant mother, lactating mother and pregnant women, they actually require more protein and micronutrient dense food. And adults require more of calorie dense food. So if the situation continues, actually nutrition education can play in choosing the best food out of the available money. For example, some cultured fish, tilapia, pangas, these are relatively cheap than other fish. So how to choose appropriate food and who should get the priority. So on this end, we need some educational intervention. So thank you.
Thank you so much. There's another question for you as well, Mr. Shamim, which is, right now it's very tough for a lot of people to go to the markets, to go shopping. Not everyone is being able to go. We're focusing on home delivery foods, but also a lot of people, maybe people from middle class and above, we have our cell phones, we can order food from Shahoj and they'll come and deliver it to our house. But not everyone's able to do that. So can the government take any steps or can any organizations take any steps where people don't have to go to the markets to buy their food? They can get their food from other means. Do you think something could be done in that case?
I think program people can better answer this question. Definitely, not all people are using the home delivery. A lot of people are going out to market. At Malay actually covered this issue. So maintaining safe distance and mask and hand washing practices, going to shopping is actually not unsafe. And if the lockdown situation continues for very long, possibly we have to actually learn how to live with this situation.
Can I add something
sure.
on this?
Yes, sure, sure, of course.
So, of course, you cannot really ask the government to do everything. Government cannot, do the business. But there are, these e-commerce companies, and you have seen in the last few months that new companies have come up as well. In our recent experience of locking down the Purbo Raja Bajar area, the e-commerce companies were kind of exclusively engaged in supplying the essentials to that location. I think this kind of opens a lot of opportunity for the country as well if the government or authority coordinates with the e-commerce companies and through their association is quite dynamic. They can cover a big portion of the metropolitan area. It cannot be, they don't have the logistics to cover the rural areas still yet, but the urban areas they can actually cover. And then a low number of people will have to go to the market, and the chance of infection is becomes low. Although Professor Malay and Mr. Shamim mentioned it's safe to go to the market when you maintain social distance, but if you happen to go to the market, you see that in our culture, people do not really maintain the safe distance, and in some places it is actually quite impossible to maintain safe distance. If you go to a local wet market, in many places it's almost impossible. So I think this can kind of modernize our way of doing regular shopping as well, if we take this initiative now.
Rafi, I wanted to add on this. So I was talking about the urban-rural divide. And in the urban areas, basically the blow is coming towards the urban industrial workers working in large garment factories or even electronic companies, light engineering companies, and so on and so forth. So the opportunity that exists there is that, I mean, think about it, if there are 10 kiosks in a garment factory where the workers can go in their convenient time and very conveniently put an order, and that kiosk is linked, I mean, the factory has e-commerce company. So what happens then, all the workers' demand is aggregated for the day, and then the company delivers the product at the factory gate in the morning, and it's all named under the worker's name, and they can just take it away and go to their home. So it reduces the need to go to the marketplace. It improves efficiency in delivery and so on and so forth. So, I mean, often we put the focus on individuals, but I think what COVID is showing to us is that, I mean, in Bangladesh, there are lots of organizations and institutions, and we probably need to think about how we can leverage on those institutions that exist. Even in areas, let's say, I mean, there are community welfare societies, right? So the welfare societies could also work as an aggregator of demand. And then, I mean, if it is locked down, the food can come inside the area, I mean, very easily.
Thank you so much. So I'm going to end with this last question. This question is to all the four panelists. I'm going to start with Professor Malay. This question is actually coming from one of our colleagues at BRAC, James Street School of Public Health, Bachelor. She has mentioned that, you know, all these recommendations and everything that we're talking about, it's all very good. It's good to hear. But how practical and feasible is this for the poor people when, you know, they don't have food, they don't have money, and they have to depend completely on food relief? So how practical are our recommendations? Will they be able to do it? Professor Malay, if you could start.
Okay, so I think there was another question about face mask, whether there is any size for children's face.
Yes. You can also add that as well.
So I want to answer that question first, because I mean, there are several sizes of face mask, like 5 sizes that is mentioned in different literature. So, so of course, like there are special sizes for children, teens, and women, and then men, and like so if you measure from the crease of the nose and like to the like under the chin, so that is basically like how the measurement talks about the mask measurement. So for children, this is about 5 inches. And then for adults, it can be from 6.5 to 7 inches. So, I mean, the point is like there are different sizes for children and adult and also for women. Yeah, coming back to the questions about like whether these recommendations are feasible for poor people. I mean, during the crisis, of course, like the poor people need cash incentive. They also need food support. And when we are providing them with food support, like welfare food program and FAO, they also like add micronutrients, even to like different vitamins to rice. And so so we must think about like These are the needs for the people, and during the crisis moment, and when we are also fighting a pandemic infection, we must prepare ourselves so that like our immunity is stronger, and when we are infected, we have a chance to win the fight against this virus. So from that perspective, yes, like the government and other agencies should provide for the poor people, should provide food support, cash support, and also when they are preparing the food baskets for ultra poor and poor, they not only think about the energy content of the food basket, but also nutrient and micronutrient contents of the food basket. But when cash is given, sometimes people do not have the necessary information and knowledge to prioritize food, as other speakers already mentioned. For example, if you think about egg, so an egg is about 50 grams. And so 20 eggs is about 1 kilogram. So that if you want to buy 20 eggs, so that is less than, it's about 160 taka or 150 taka. But if you want to buy 1 kilogram of fish, so that is much higher than the price of the egg. So you can actually buy egg, and egg has got high protein content, and replace other forms of proteins during the crisis. So there, I mean, these are true for other fruits and vegetables. Like they are cheaper. Cheaper fruits and vegetables compared to other, expensive fruits and vegetables. Even the nutrient contents of those fruits and vegetables are basically the same. So, so the knowledge about, nutrient contents, fruits and vegetables, and how to replace them with cheaper and more accessible form of food items is of paramount importance, especially at this crisis.
Rafi, I need to go. I just wanted to quickly answer this question, and then I have proposed several interventions which are all on the merit that poor people are not being able to purchase. So, starting from the lowest, I said, let's try to create smaller packages for protein content so that the poor people can buy it. There's a huge demand for that is untapped. So can we do so? And then, just as I said, in our Proshar model, people have started to buy egg, which means that, people do know that they need protein, and egg could be a cheaper source. So they're doing so. But also what is happening is that because people's mobility is restricted, and usually they would have to walk long miles to go to a vegetable market to buy vegetable, and the local groceries in rural areas do not necessarily, stock vegetable, or let's say, they don't have the capacity to stock fish. So, there's a disconnection. So, and also, let's say, I said that you cannot buy chicken as a whole because it's big, but probably if we could invent now a system of, let's say, having smaller slices of chicken and fish, and make it marketable in a portable frozen, let's say, baskets that are available in rural groceries, then poor people would be able to purchase. But this would all require now new way of thinking how we reach out to the poor people. And only then it then can become, feasible. Thank you.
Thank you so much. Mr. Imran, do you have anything to add?
No, I think that's fine.
Want to add?
Yes, sure.
Definitely, there will require support from public support to maintain the health and nutrition of poor people. And Malay and others actually mentioned about education, how to choose the right food and how to target the food to the most vulnerable member of the household. I want to actually emphasize another issue. So vitamin D is becoming a very well-talked issue in the context of COVID. And we have a previous research that vitamin D status of Bangladeshi population in general is very poor, and only food cannot actually support the food, vitamin D requirement unless people eat lot of fortified food or lot of seafood. That is why exposure to sun for say 15 to half an hour is important, and if people cannot maintain that, uh, they should actually take vitamin D supplement. And about portion, I want to emphasize that actually so availability is also a barrier, because when a primary school student go to school with 5 taka or 10 taka pocket money, in the grocery store you will find all the unhealthy foods are available: chips, chanachur, shingara. But healthy food, for example, banana or boiled egg or milk in 100 ml Tetra Packs, these are not actually available. So we should actually work how to make healthy food available in small packs so that people can buy with 5 taka or 10 taka. So this is another area organization should think. Thank you.
Thank you so much. Yes, Mr. Rubaiyath also mentioned the same thing about the chicken, that we can do something of that sort. So
can I sorry, I missed one point on this. So we mentioned that the nutrition related knowledge, people actually do not have a thorough knowledge. So government can focus on this in the messaging in TV or other media. This specific and programs, different programs, NGOs who are working at the field level, they can do that. But I want to emphasize, with our small initiative, I shared the link in the chat box, proshar.org. We have seen that general people, even when they do not have the very high level of nutrition knowledge, they are kind of choosing things that will kind of give them more or less a balanced diet, as I was mentioning. And we can actually share this type of information on the choice of people's food basket based on constrained amount of money. So they are purchasing carbohydrate, they are purchasing protein, they are purchasing vegetables with the meager amount. They're also purchasing other essential items for the household, non-food items, the soaps and stuff like that. So people can make a decision on their own, probably better than a centralized decision. If we ask the government to develop a food basket, that will be kind of a very common things that are easy to transport, that are non-perishable. But if we kind of leave it to a distributed decision making for the general people, people probably can make their own decision better.
Thank you, sir. Thank you so much. Unfortunately, that is all the time we have today for questions. And I would like to thank our audience members and also our distinguished panelists for joining us today. Thank you so much. It was a very informational and an interesting webinar at a time like this. I would also like to thank our webinar team from BRAC, James Mridha School of Public Health, who have been working behind the scenes to present this webinar to you. So thank you everyone again for joining us today, and we hope to see you all next time for our next webinar. And please stay safe, everyone.
Thank you.
Thank you.
Bye.